Well, athletics have always been a part of my life. As a child, I played every sport there was: basketball, volleyball, soccer. I was a gymnast for almost my entire life, and then I rolled right into the military, right into CrossFit. So everything I've ever done is athletic based. I have an 11-year-old son, Andrew, and he's our only child. We're out in the front yard playing basketball or even kickball, and there was to a point where I couldn't even run down the street to chase the ball that he kicked. I felt like I had a pinched nerve in my lower back, and then from there I had numb feet, and then from there it went to a completely numb leg and excruciating hip pain. Well, when we were going over the pros and the cons of this type of procedure, what I really liked about it was the least invasive of all the spinal fusions I felt. You don't have to cut muscle or nerves. The recovery part of it, for me, as long as I did my part in recovery, seemed like the best route for my lifestyle. Within 2 days, I was home. I was up walking. Within a week, I had zero pain. I can run and jump and swing and push and whatever I want to do. Afterwards, I get a little bit sore, but that's just from muscular pain working out. And I had a lot of people in my ear telling me, "You're too young for a spinal fusion," or "Once you fuse that joint, you'll never, move again, you'll never bend again." But once I met with Dr. Williams and the UW team, he really made me feel like it was going to happen again. Sometimes I do forget that I had major back surgery, and other people, if they mention it, and I tell them, "Oh, I just had a spinal fusion a year ago," they're like, "What? You're kidding me." Or when I go take a PT test with my coworkers and I'm running really good or doing sit-ups. Sit-ups is something that I really didn't know if I would get back because of that, just the angle of that movement, but still doing 90 to 100 sit-ups in that 2-minute time period.